Pete.
Hi.
Today we're going to talk about how your swallowing is going to be affected by radiotherapy, and I'm going to give you some exercises for swallowing during radiotherapy.
Okay.
The first thing to think about is how your swallow works.
Right.
So when we swallow, your voice box lifts up and tilts forward to allow your epiglottis to cover your airway. And your airway is in the front and your esophagus is behind. And so when you swallow, your voice box lifts up, tilts forward, your epiglottis covers your airway, and food and drink goes down your esophagus.
Wow. Sounds kind of complicated to me.
It is, and it all has to happen promptly and completely to allow that airway to be covered.
Okay.
So that's why it's important during radiotherapy to do some exercises to keep all those muscles working. Because during radiotherapy, we know that those muscles can get a bit stiff and wooden. It can be painful to swallow, and your saliva is affected. So your saliva gets quite thick and gooey. Your taste buds also can be affected. And so swallowing becomes a little bit more difficult.
Right.
And that is why you have a stomach tube called a PEG tube fitted at the beginning of radiotherapy to allow you to use it to supplement your nutrition. So you can still eat and drink with your stomach tube, but we want it there so that your nutrition and your hydration is supplemented.
Okay.
So let me go through the exercises with you. Aim is to do them 5 times a day. So little and often is best.
Right.
The first one is your jaw opening. And that is to make sure that your mouth opening stays as wide as possible. So you can check how wide your mouth can open by the finger test.
Right.
By just putting your fingers in your mouth so you can get 2 fingers in.
Yeah.
And that's worth doing sort of once a week to make sure that it's not getting tighter.
Oh, right. So it can get less.
Yes.
Okay.
Yeah, so that's a good, easy check.
All right. Okay.
And what I want you to do is to open your mouth as wide as possible. Hold it for 7 seconds. 2, 3, 4, 5, 6, 7, and relax.
Yeah.
And we're going to do this 7 times.
Oh, okay.
So open again. 2, 3, 4, 5, 6, 7, and relax. And again. 2, 3, 4, 5, 6, 7, and relax.
Mm-hmm.
Keep going. 1, 2, 3, 4, 5, 6, 7.
I'm beginning to feel that on here.
And again. 1, 2, 3, 4, 5, 6, 7. And again. 1, 2, 3, 4, 5, 6, 7. And last one.
Okay.
1, 2, 3, 4, 5, 6, 7.
Ooh.
Good. Well done.
So how many times a day do I have to do that?
5 times.
Wow. Okay.
And that really keeps the jaw muscle to stop it getting tighter. And
that what makes it tighter? Is it the radiotherapy that?
it's the radiotherapy
Right.
that affects the muscles, and you're in the mask, so you're held quite tight, so you may hold your jaw quite tight,
Right.
as well as the radiotherapy
Okay.
stiffening those muscles.
Okay.
It's Important to open your mouth to a stretch, but not to pain. If it's painful, just reduce it a little bit. And if you are in pain, take regular medication and do these exercises 20 minutes after taking
like paracetamol or something like that?
Yes, yeah.
Okay, all right. 5 times a day?
Yes, yeah.
Okay.
And that's important to keep those fibres stretched those
All
muscle fibers stretched.
Okay.
Okay. The next exercise is the tongue hold technique. So I want you to bring your tongue forward between your teeth.
Yeah.
And if you haven't got any teeth, you'd bring it between your gums and hold it in that position and then swallow. And that stretches the back of your tongue
Right,
and
it's
mouth.
hard.
It is hard,
Yeah.
but it's a really good stretch. And you may need a glass of water to make sure your mouth's not too dry.
Okay.
And so I want you to do that 2 to 3 times.
Right. So it gets harder each time, doesn't
It does.
Yeah.
So have a sip of water if you
I
need.
will.
That's it. And just try once more.
Yeah.
Good.
Not
good.
easy, that one.
No.
5 times, again 5 times.
Yes,
Okay.
yeah. The third exercise is the effortful swallow. And this is to be done with a spoonful of yogurt or porridge or a drink. And I want you to feel like you're swallowing a golf ball and feel like you're squeezing those throat muscles together. And squeeze hard. Squeeze those throat muscles as you swallow. So to really work those muscles hard.
Okay. Difficult to know whether I'm doing it properly, but yeah.
That's it. You may need to tuck your chin in slightly.
Yeah.
Swallow hard. Squeezing your mouth
Oh,
in.
I see what you mean. Yes. Yes.
That's it.
Yeah. Okay.
Squeezing your mouth and
How
throat
many
muscles.
times do we do that?
Just 2 to 3 times.
Oh, good. That's good. No, that's 2.
Well done. And one more if you can.
And that's 3.
Good. The last one is the voice box lift. So as I talked about earlier, your voice box lifts up and tilts forward. So we want to make sure that those muscles keep going.
Okay. And what about this thing? This goes up and down. So.
Yes, so your voice box. So if you put your finger on your Adam's apple, that's the front of your voice box.
Yeah.
And I want you to swallow now.
It goes up.
So you can feel it going up.
Yeah.
So it moves up and tilts forward. And that needs to happen promptly. So can you do that once more? Good. And then take your finger away. And now I want you to swallow and try and hold it in the upward position for just a couple of seconds longer. Well done.
So how many times does that one have to be done?
Just 2 to 3 times.
Like it's hard. That was a hard one as well.
It is. So you're really working these muscles hard to keep them moving. Well
Yeah.
done. Well
Okay.
done. And so it's important to do these exercises 5 times a day to keep those muscles stretched. It's a bit like the old phrase, use it, don't lose it. You're really just moving those muscles and keeping them stretched.
And how long do I have to keep doing this? I mean, my treatment is scheduled for something like 5 weeks. So
Yep. So
every day for 5 weeks. And what about after? Do I still have to do it?
absolutely. So we say keep doing them at least 3 months after treatment.
Wow.
And that's because we know that the muscles can still get fibrosed after the
And
treatment's
if I
finished.
don't, what happens?
Things can get quite stiff and wooden, and so your swallow can be more difficult and your jaw can be a little bit reduced.
In that case, I will do it 5 times a day.
And good.
Right, thank you.
And you'll notice during treatment that the side effects accumulate, and they're often at their peak 7 to 10 days after treatment, and then you start to turn a corner. And you may not notice that you've got any side effects for the first 1 to 2 weeks, but then they gradually come in.
Okay. Thank you.
Okay.